Thank you for joining today's live educational webinar from HIA-LI Manufacturing and International Trade Committee. Today we'll be talking about business strategies in the face of a pandemic. And especially today we'll talk about health and safety management in the workplace. Thank you very much for joining. And as you know, we are Manufacturing and International Trade Committee of HIA-LI. And my name is Kevin Devecioglu. I'm one of the co-chairs of the committee. Today I'm with our co-chairman, Ron Loveland. He's also with us today. And we'll talk more about our committee, our mission, and also what is coming up next in terms of our coming events. So as our manufacturing committee, our mission is to help manufacturers thrive and become more competitive in the marketplace, especially high-cost market of New York, basically. So we put together various events. We have factory tours. We have educational meetings, typically, of course, on-site meetings, and we also do webinars periodically, every month, typically. And our idea is to basically invite experts in different fields and learn from them to improve our manufacturing and international trade practices. That's our mission. And to, of course, learn more about our events and our activities, you can visit our website on HIA-LI official website. To talk about our previous activities, our committee meetings, in January we met at Microsoft in Garden City, New York, and we talk about digital transformation of manufacturing. Especially we focus on the technologies that manufacturing organizations as well as other businesses actually can utilize. We talk about AR and VR technologies. We talk about cybersecurity. We talk about paperless and digital quality management, as well as predictive maintenance, for example, for manufacturing operations. And we talk about data science centers for manufacturing and international trade companies, as well as general businesses. Last month in February, we met at Sunation in Ronkonkoma, New York, and we talk about green manufacturing practices. And when we say green, we mean environment-friendly practices. And we learned about solar energy systems and how actually you can utilize them from Sunation, for example, as their specialty. We also heard from manufacturers in terms of best practices of green business practices. So that was also very educational last month that we met at Sunation in Ronkonkoma. So as soon as things normalize in the marketplace, we'll continue our on-site meetings as well as factory tours and educational on-site meetings as well. For now, we focus on online meetings, so we continue sharing educational information and insights with manufacturers and businesses of Long Island as well as New York. And in this case, webinars are actually nationwide, so we are actually sharing with Nation in this particular case. So we are very, very excited for that. In coming weeks, we'll be talking about cybersecurity, lead generation in business as well as manufacturing and international trade. We'll talk about paperless business practices in various webinars that we are organizing in coming weeks. We'll talk about grants available for manufacturers and different businesses. And we'll talk about digital transformation of manufacturing operations. So these are coming webinars in next week. And so please follow our events and our event page and our announcements, basically, so that you can register and follow our coming webinars. All right, great. So today we'll be talking about safety and health management in the workplace. As I mentioned earlier, my name is Kevin Devecioglu. I'm a co-chairman of HIA-LI Manufacturing and International Trade Committee. Today with me, I have my colleague and our co-chairman, Ron Loveland, from Manufacturing and International Trade Committee. And also we invited an expert, Kristen Panella. He's a certified safety professional. He's also from Summit Safety and Efficiency Company. I am with Bimser International. We do digital transformation as well as quality and maintenance management for companies. And Summit Safety and Efficiency runs companies specialized in safety and efficiency practices. So before further ado, what I'll do is I'll hand it over to Ran. Ran, would you like to take it from here before Kristen shares his insights with us?
Yeah, absolutely. Thank you, Kevin. Thanks for inviting us along to chat with our constituents about safety in this really tough environment right now. I think top of mind, a lot of people are thinking about, how are we going to deal with this coronavirus? How are we going to keep our people safe? How do we keep our families safe? How do we keep us from being infected and infecting others? So we're going to chat a little bit about strategies we can have, what the responsibilities are of manufacturers, of business owners, and also talk about some strategies that you could take to keep your people safe. As you may know, the Occupational Health and Safety Organization Administration, OSHA, requires you as a business owner, as a manufacturer, to keep your people safe, to put strategies in place. And I've been getting a lot of phone calls from manufacturing folks asking, what do I do? How do I handle this? The other issue is essential, right? Are we an essential business? Do we fit into that category? And should we keep operating, or should we, just shut down and wait for the all clear to come back? So I'd really like to turn this over to Kristen, because he's really our expert in this area. Just a little background on Chris. He's a certified safety professional. He has over 20 years of professional experience in the environmental health and safety field. He has a background in geology and environmental management, worked with numerous EPA Superfund sites, as well as emergency hazardous materials spill cleanup sites. He's completed hundreds of environmental phase 1 and phase 2 site assessments. He is accountable for environmental health and safety that issues that face our clients. And for a lot of our clients, we've become, you've heard of the outsourced CFO model. We've become the outsourced safety officer, where we go in and do all the heavy lifting for a client that maybe is given safety to somebody as an extra duty. Sometimes the HR manager, the ops person, the facilities manager, given it as an extra job, and either they don't have the capabilities or they don't have the time to be able to get it done. So we go in there and do the job hazard analysis, the written plans, the training, the audits, and help them to build and maintain a strong safety program. Some of the advantages of having a robust safety program include, better workers' comp insurance rates, of course, avoid EPA and OSHA fines, and then most importantly, keeping your folks safe and keeping them on the job. Just a little bit more about Kristen. He's also an adjunct professor of environmental technology masters and continuing education at NYIT, and he's an active member of AIHA, ASSC, CHHEMA, SCHA, and serves on Cold Springs Harbor's Laboratories IBC. He's got a bachelor's in geology from Stony Brook and a master's in environmental technologies from NYIT. So without further ado, I'm going to hand this over to Kristen, and he's going to talk about, some of the impacts of the requirements of OSHA and how you can keep your folks safe in this tough coronavirus environment.
Great.
Chris?
Thank you.
Thank you very much, Ron. I appreciate it. Good afternoon, everybody. I've done thousands and thousands of public speaking events. However, this is the first one I've ever done in shorts, so I'm super excited about this one today.
Welcome.
I think we want to talk about safety. We want to talk about the coronavirus, COVID-19. We kind of want to talk about disinfection, but I think what's more important, especially for this group, is business continuity, right? In this time, a lot of things are shutting down. Maybe our people are getting sick. Maybe we're mandated to shut down. Maybe someone came in that was sick and now people have to go home for 14 days. How do you keep your workforce moving? How do you keep your clients with the orders? Business continuity is very difficult in a time like now. Safety definitely is a proponent of that. I believe that if we keep our employees safe, if we keep our heads clear and we make good decisions, good intelligent decisions, that this too will pass. But we don't want to make any harsh decisions in a crazy time like now. We currently have a saying as this goes on is that the CDC is as clear as mud. That there is no lack of information out there right now. You turn on the news and maybe there's no new news, but they're talking about the same thing over and over and over again. So I don't believe what we're dealing with takes rocket science. It really doesn't. I think we have to be aware, and we have to try to make those clear-headed, intelligent decisions. And so that's what we try to help our clients with, is to kind of navigate them through these murky waters right now, because there's a lot of information, there's a lot of misinformation. Sometimes you can go way above what's really necessary, but we kind of want to make sure that you're moving in the right direction. So let's talk about coronavirus. I mean, at this point, I think everyone kind of knows what it is. It's a strand, it's a virus. It's called COVID-19. The coronavirus has actually been around a while. It was called corona human virus. A lot of the disinfectants that we use have been geared or engineered to kill corona human virus. This is a different type of strand, but the disinfectants still kill that. So specifically with that, again, it just causes flu-like symptoms. It does have a higher death rate than the flu. There are concerns of how it's going to move forward, but I am not a doctor, so I don't want to turn this into what your nightly news talks about every day. What I want to talk about is your business, and let's say if you do have confirmation that someone has coronavirus, and what to do. The CDC, and more locally, what we're following here is New York State Department of Health. Obviously, we have a Nassau County Department of Health, and we have a Suffolk County Department of Public Works, or Health Services in Suffolk County. So those are the more local ones. But really, what's driving the bus here is New York State Department of Health. Governor Cuomo constantly puts out news information about what businesses need to do, right? So I'm just kind of repeating what everyone kind of knows, but the current state of New York is that we are on pause, right? And what does pause mean? Pause means that every non-essential business is to shut down. Now, again, I say it's clear as mud because it's like, okay, shut down, but for a day, for a week, for a month, how long do we need to shut down? And there's no clear answer. There's no clear answer. But as of today, which is March 25th, if you are a non-essential business, you need to stop business. People should not be coming to work. All right, so now let's define what a non-essential business is. Good luck. So they put out a list on their website of what a essential business is, right? So and the simple ones are, okay, hospitals, healthcare facilities, elder care, emergency services, right? That's easy for everyone to kind of figure that out, right? Any medical supply store. But there's so many gray areas. What if your company supplies that medical facility with masks? Maybe you supply them with, I don't know, needles. Does that make you an essential business? In my opinion, yes, it does. But it really depends who you ask what their opinion is. But there's also essential infrastructure, right? So if you're a utility company, you're not going to be shutting down. If you're an airport or telecommunications or transportation or hotels, again, not necessarily shutting down. They consider that an essential infrastructure. Essential manufacturing can be food processing, if chemical processing, medical equipment or instruments. If you produce any type of pharmaceuticals, you're an essential manufacturing and you are not to shut down. Sanitary products, telecommunications, microelectronics, architecture, agriculture or farms, or household paper products. We have a couple of manufacturing clients that fit into one of these essential manufacturings, and then anyone that supports them as well. There's also essential retail. So you have grocery stores, pharmaceuticals, convenience stores. The list goes on and on and on. The problem comes is the gray area, right? So that's where it becomes very difficult if you're in that gray area. What about a contractor? What about we have clients that are roofing contractors, or the list goes on and on, but and your imagination can go wild whether or not you're essential. And we know as business owners that it is extremely difficult to shut down and comply with New York State's new pause that's taking place. Okay, so moving forward, let's say you are an essential. Let's say you're in that gray area and you are producing, you're still manufacturing, and you have an employee that tests positive for COVID-19. What are you to do? Well, number one, that person obviously stays home. They are not to report back to work until they have a clean bill of health from their doctor. That's dealing with just that employee. It becomes a HR issue at that point because you are talking about someone's medical situation that you're dealing with. So it's definitely an HR. It's got to be sensitive. We're not going to plaster all over the place that Joe is sick and he infected all these people. We have to make sure that we're very sensitive to them and their families as well. It's become a real issue in the school districts when a student tests positive, and then other students tend to be mean to them or attack them on social media. We want to make sure that the same thing doesn't happen in our workplace. So it is an HR issue, and we need to be sensitive about it. New York State says anybody that came in contact with that person needs to be on 14-day quarantine. Now, I heard that, and I know a lot of other people heard that, and your eyes just go, what? You know how many people that person came in contact with? How can I send them home for 14 days? How can I operate? New York City Police Department is trying to adhere to this, and they are having all sorts of problems, right? They have over 2,000 police employees that have to stay home. It's becoming a real issue for NYPD. Not only that, but they have over 200 cases of police officers that tested positive. So the numbers are staggering. The clock ticks from the time that they came in contact with that person. So the clock is a little bit weird on your 14-day self-isolation, because let's say Juan was infected last, what's today, Wednesday? So let's say last Thursday, Juan came in and felt terrible and was sweating, and then all of a sudden someone saw him and his supervisor says, Juan, what the hell are you doing? Why'd you come to work? Go home, right? So he goes home. He came in contact with 3 people, let's say. The supervisor, and then 2 other employees that he works with. So that was last Thursday. Juan goes to the doctor over the weekend, gets a test done on Saturday, and Tuesday it comes back positive. He gets the results Tuesday. Well, that's self-isolation for the supervisor and the 2 other employees that they came in contact with. They have to self-isolate for 14 days, and that started last Thursday when they came in contact. So it doesn't start when the test came back positive. It goes back to when they started. So again, it would be they came in contact last Thursday. I forgot what the actual date was, but anyway, it would be 14 days from that last Thursday, just so we know. So that's what New York State says. And they kind of get that from the CDC, but it's very clear on New York State's Department of Health that's self-quarantine. So as an employer, you kind of have to do that. After the fact, we do want to clean up the area anywhere that he tests. Rarely is COVID-19 transmitted through the air, unless someone sneezes in your face or coughs into your mouth. It's not going to be transmitted that way. It's going to be transmitted on surfaces. So doorknobs, handrails, light switches. Again, everything that you see on Channel 12 News, same thing here. We want to make sure that we disinfect all those surfaces. You could use in-house cleaners. We find that some in-house cleaners, especially if they're not educated, they get a little bit scared and they don't want to do the work. You can't necessarily force them to do the work. It becomes a very tricky area. And so that's why we've been called in on numerous times to kind of come in, educate people on how to properly disinfect the workplace. We would want a full inventory of everywhere that that employee worked. If it was an office personnel, hey, that's great. That's easy. We got an office, we got a boardroom, we got a lobby area, we got some walls, no big deal. But what if that was someone that worked on your manufacturing line and they worked on many lines and were around many people? That's when it becomes a little bit more labor intensive and a much larger project. So it can go from a small project if it's an office personnel to a very large project if it's somebody that moves around a lot, a forklift operator, like I said, someone that works on your machine lines, or we had one case where it was an actual cleaner that was in a building and cleaned multiple areas and touched multiple surfaces. So we would have to go in and disinfect. Now, again, let's move forward with disinfection. So how would you disinfect? What do you need to do disinfect? It's not clear. I mean, we've been disinfecting forever. MERS has been around forever. SARS has been around forever. We deal with a lot of hospitals where there's a confirmed case of the measles or the mumps still, and we have to come in and disinfect. So our disinfectors that come, they're not cleaners. These are people that clean up. They're well educated, and they are environmental disinfectors. So they come in, they will be in a Tyvek suit, they wear their booties, they wear their gloves, and they wear respirators because they're spraying chemicals for 8 hours a day, every day. The chemicals that are used to disinfect, New York State recommends in the CDC a bleach solution, which is pretty simple. That's what you would do at home. We've come in a lot of issues with using the bleach solution. One is that everyone's freaking out, so they'll use pure concentrated bleach. That's not what you're supposed to use. You're supposed to use a 10-to-1 bleach solution. You want to dilute the bleach. You don't need to use full concentrate. The other problem coming in with bleach is, can you imagine cleaning an office with bleach? We would ruin every tabletop. We would ruin every screen, every keyboard and mouse. So we use different types of disinfectants. Specifically, the one that we use is HIA. Alpha HP is one of them. And then the other one is Vitrex 256. We've used them for many, many years. Again, we've been dealing with bloodborne pathogens in whether it's hospital industries or the workplace for ages. So this is nothing new. This is just another virus in a long list of hundreds of thousands of different types of viruses that are out there. And it's not stronger, or it doesn't last any longer than the flu or anything like that. So we use typically the same chemicals that we've used for that. We do have to be careful with your employees if they use the chemicals, because now we get into chemical safety. Again, if a employee is not knowledgeable, they will use pure concentrate of that chemical and not dilute it properly. And that's when someone can get hurt, right? So can you imagine someone just taking a bottle of bleach and scrubbing a floor? Not only is that person going to get hurt, but everybody in the area is going to get hurt. And that just comes out of lack of knowledge. And if they're anything like our workers, if they are going to use it, imagine cleaning your bathroom. If you had to clean your bathroom, and you're in there for an hour scrubbing with bleach, you probably wouldn't wear a respirator, not a big deal. Our workers are using it 8 hours a day, every day, so therefore they have to wear respirators. Then what happens is you get into OSHA's respiratory program, which now you got to be certified to wear a respirator. You can't just throw a respirator on. So everyone's got to be fit tested. They have to have a physical to make sure they're physically fit to wear a respirator. And so it goes on and on. So that's why a lot of businesses have been just kind of subbing it out. Here, please go take care of it. I don't want to have to worry about this. You guys go do it. And we've kind of came in, educated our clients, and have cleaned up or disinfected for them. Disinfection, people just kind of throw around that term. There's actually different ways of thinking about it. There's cleaning, okay? There's cleaning, that's one thing. There's disinfecting, and then there's sanitizing. And we have to know the difference between the three. So cleaning actually just removes germs and dirt and debris and stuff, which is essential, because viruses can hide under different types of biological materials. So if you have a virus and then there's some dirt on top of it, or soap scum, or any type of scum, it's going to protect it and it could last much longer. So if I just spray some sort of disinfecting spray, it's not going to get past that dirt to actually sanitize. So once I disturb that dirt, now the germ's out and you kind of did nothing. So you want to make sure that we properly clean first. So that's going to be wiping down the areas, getting rid of all dirt and debris and anything that could potentially protect the virus. Then you want to kind of come in and disinfect, and that's where the chemicals come in. The chemicals come in and they will kill any virus or germ or bacteria that potentially could be in that work area. So you definitely want to keep cleaning on a regular basis. If you have cleaners at your facility, keep them cleaning, keep them mopping, keep them wiping down surfaces, definitely community surfaces, keep them cleaning bathrooms. But what I would recommend is also having them disinfect. So that means also having sanitizing wipes, wiping down doorknobs, handrails, light switches. So that should be added to the scope of work of what they're probably already doing. And I think that's essential in not spreading this type of virus. You would want to do that any flu season. You would want to do that anytime there's an outbreak. You know, we had H1N1, we had all these outbreaks. You would want to add that to the scope of work. So that sanitizing would really have to be added to their what their daily duties are. But continue to clean. A clean workplace is a sanitizing, is a nice environment where we will lower the number of germs. So we want to make sure that we keep on cleaning. Then once we disinfect, when we are disinfecting, chemicals have what's called contact time. Okay, even bleach is the same thing. Bleach is designed to kill organic material. Think about sticking your hand in a bucket of bleach. I could stick my hand in a bucket of bleach and take it out real quick and wash it off, and I'll be perfectly fine, right? My hand isn't going to hurt me. However, if I take that bucket of bleach, stick my hand in it, and I leave it there for a while, well, now the bleach is going to do what it's designed to do. It's very corrosive. It's going to start to eat away at my hand, or that organic material. It's going to eat away. So it needs time. It needs time to do its job. So that goes for any disinfectant that you have. You don't want to spray it and then wipe it up right away. You want to spray it and leave it there. And every chemical has a different contact time. Okay, we use some chemicals that are 5 minutes. We have other chemicals that are 10 minutes. So pretty much what we tell our cleaners is go in, spray everything down, and then come back and wipe it up. Because it depends on what disinfectant you're using, but they do leave some sort of residue, which could be good or bad. If it doesn't leave a residue, no one thinks you cleaned or disinfected the area. They also make disinfectants with odors and without odors. We found the ones without odors, people think that we didn't do anything. Whereas if ones that do have an odor in it, people love it and they're like, wow, you completely disinfected. So we tend to use the ones with the odors in it because we just get more customer satisfaction out of that one. So that's it as far as disinfecting. And then with all that PPE, our employees have to be trained on the proper use of PPE. We can't just give them an N95 and say, here you go. An N95 works well. Please understand in this situation what an N95 is for. It is for you to protect yourself against yourself, okay? It would be very rare for anyone to sneeze in your face or to cough in your face. If someone did, yes, the N95 is going to stop that virus from getting into your body, which is great. However, what it's really designed for in this situation is you not touching your nose, you not touching your mouth. So let's say you get the virus on your hands from touching your workplace, and then you touch your nose or you touch your mouth, you know, they say, I think it's 23 times in an hour, okay? So it protects you against yourself getting that virus. N95 does work. Viruses are very large, so the filter media and N95 does work well. But please understand that the N95 is a dust mask, and that's what it's designed for. So we cannot use an N95 for painting or using solvents or anything like that. The dust mask or the N95 will not protect us against that stuff. So we have to be careful that we make sure that our employees know what the N95 is actually for. Okay, so we want to make sure that they are knowledgeable in the use of that. Okay, so we touched on disinfecting, we touched on PPE, we talked about the state of affairs. I believe that we went through everything that I needed to talk about. I would love to use this time for questions. There's been 100 questions out there, and I think they're all awesome. I don't know if I necessarily have an answer for all of them, but I sure as heck will get the answer for you.
Thank you, Kristen. We appreciate your input. Very valuable experience you've had addressing this virus as well as other viruses. So I think you bring a lot to the table here.
Yes.
What questions do we have out there?
Thank you, Kristen. I appreciate it. So also, in the meantime, we keep our contact information on the screen. So also after this webinar, if you'd like to ask questions, contact us, continue the conversation, we keep the contact information on the screen for you. So any questions for Kristen? I have, so what you can do is you can unmute yourself and ask your question, so we can have it live. That's perfectly fine. In the meantime,
so Chris, I've had a couple of manufacturers come to me and say, since the healthcare folks can't get gloves, masks, and gowns, how can I protect my my guys on the shop floor?
Yeah, so it's this is a worldwide issue. New York State came out and said, we're ready for this, we're ready. Well, unfortunately, there's the rest of the world too, right? So, people buying N95 respirators from 3M are not only here, but obviously in Italy and France and Australia. Everyone in the world is buying N95 masks right now. We're getting in a dangerous area where the president is asking mom and pop shops to make them. I would feel much better if people in this meeting, maybe manufacturers would make them. I don't need mom and pop shops making them. There are ANSI standards that we would have to comply with. But again, we always say N95, this is a whole new world, right? So the N95 is a disposable face mask. However, you can't replenish them. So they're actually telling workers to reuse them, which we always recommended not, dispose of them and just use a new one. But we're in the situation where either you reuse it or you run out. So it's either nothing or reusing a respirator. So in this case, unfortunately, we are going to have to reuse our respirators until we get new ones coming in. I've heard people talk about bandanas. Bandanas will not protect you as much as an N95 respirator, so I cannot, as a professional, recommend a bandana. Again, is it better than nothing? Sure, it's better than nothing, again, because it's going to protect you from touching your face, and that's really what the problem is here. The COVID, the best thing I heard on the news was that the COVID-19, they don't have legs and they don't have wings. So they don't move. They don't move at all. The only way they get in our bodies is us doing it. So any way that you could protect yourself from getting it in your body is great. So to answer your question, Ron, it's a difficult situation. Even like someone reached out to us and asked us for N95s. We don't have them. We can't get them. Back order for 2 months.
Yeah, tough situation.
Yeah, very, very worrisome.
Just one thing I did fail to mention. Let's say you do have a positive case. We want to isolate that area as quick as possible. So again, let's say someone in an office tests positive. We want to close that door and leave it locked. It was in the boardroom. We want to close the boardroom, leave it locked for as long as possible. But before anyone goes in there, we need to disinfect that area. But the best thing you could do is quarantine that area to make sure nobody is in the same workspace that they were in. So
the
other
issue is actually getting people tested. So, what are some of the symptoms that somebody would have that you'd be wary of, and you'd say, just for precautionary, whether you've been tested or not, you need to go home?
Yeah, so it's very much flu-like symptoms. They are calling it like a dry flu. So again, I am not a doctor, so I am just regurgitating information that I heard. but it is more of a dry. So you have that dry cough. It's not like allergies where your nose is going to be running like crazy. That is not the coronavirus. The coronavirus is deep in your chest. The second that you have difficulty breathing is when you should go get tested.
All right, good info.
Yes, absolutely, absolutely. So while we are dealing with this, in the meantime, so how about the risk management for future? So, you know, so this will pass as well, right? This will pass too. So for risk management point of view, so how we should prepare also for future pandemics?
Yeah, so we definitely should, because I started off talking about business continuity, and that kind of ties in. We have written numerous risk management policies and procedures for different companies. It's difficult because you try to capture everything. You know, pandemic is the newest one. We write site-specific health and safety plans, and every construction company is asking us to insert that into their site-specific health and safety plan. And it's going back to, you know, hand washing, having hand wash stations. So any type of pandemic that you're using or how you're coming with is going back to those essentials. The posters that they put in restaurants and schools about people washing their hands. You know, if we have a workforce, especially maybe they're not well, anyway, you have a workforce that maybe isn't as clean as some of the other ones. We have to make sure that we, when dealing with a pandemic, making sure that we just have those basic housekeeping rules, keeping a clean environment and keeping each other clean and sanitary.
Yeah, the other thing I'd like to add to that, Kristen, is I've spoken to a couple of manufacturers who said they're just having a hard time getting their workforce to take this seriously and really be able to you know, make sure they're washing their hands as much as they can, not touching their face, sneezing into their elbows. But you know, it's I think an important issue here is you know, as well as the posters, is also to communicate. And this one of this manufacturers I was thinking of was having daily sessions to try to reinforce with his staff that hey, you really got to take this seriously, and you got to make sure you're washing your hands and protecting yourself.
Yeah, you know, especially in any workforce and manufacturing, you're dealing with different cultures. So any new policy or procedure you try to implement, there's a cultural aspect of that, of whether or not they, you know, buy in or not. We had a client, large warehouse, that their employees would spit everywhere. So you walk all around the warehouse and there was spit all over the floor. And they had to implement a no spitting policy, and it was like a big deal for them. And they had discipline issues because of that policy. So it can go from there to washing hands. And I think that we're going to come out of this. The United States is going to come out of this with kind of a different look on this. You know, when SARS and H1N1 came out, like I don't think it was obviously, it didn't affect everyone as much as this did. And how much this is affecting everything, a new world is going to come out of this, and hand washing is going to be a big part of that.
Absolutely.
I think.
It's elementary.
Oh yeah, go ahead. Yes. So I was gonna say I think we'll use more and more technology. I think it's coming, like all the policies, procedures that we put in place, for example. So you can, you know, stick it on a board for them to read. But we can also, I think, utilize some more technology to, you know, make sure everyone reads the policies, everyone follows it up, basically. And then we record it. Actually, we keep the digital recording, you know, later for maybe OSHA audits, inspections, perhaps, or just for our, you know, internal audits, perhaps, or inspections. So I think we're going to be using more and more technology as well to make sure the policies and procedures in place. Everyone is reading it. They know. Everyone gets the memo, by the way, and then they read it. We basically capture it, we document it, and then actually we basically follow up. Make sure they are actually practicing it basically. So from my point of view, I think in terms of health and safety risk, also from the risk management point of view, we'll have to utilize technology more. That's, I think, where we are going eventually.
Yeah, speaking of technology, Kristen, what's your opinion of using traditional washing where you spray and wipe as opposed to ultraviolet or some other technologies that people are using?
So understand that hand washing with soap is number one. That works better than any technology that's out there. Simply washing your hands with antibacterial soap, which all soap is antibacterial now, is the best thing you could do. In lieu of that, you could use any of the others. Understand when you use hand sanitizer, right? So, and it can't be the organic stuff. Again, you saw all the information out there. They're saying 60%, but forever it was 70%, 70% alcohol. I don't know who came up with 60%, but anyway, you want to make sure that it has alcohol in it. And that's because you don't have a hand washing station. I think in construction sites, you're going to start to see hand washing stations. I think out on manufacturing floors, you're going to start to see more hand washing stations. But in lieu of that, you could use hand sanitizer, which is good, which will kill the germs. However, what I try to say, because I deal in the environmental field with chemicals, is that use hand sanitizer. It doesn't clean your hands, right? Okay, it's not going to take the dirt off. It's not going to take the grease off. It's not going to take the other chemicals that you have on your hands off. It's just going to disinfect. It's just going to kill the germs. But their UV light is fantastic, right? So they're talking about the coronavirus simply going outside. The UV light that the sun emits is fantastic. It kills tons of germs and viruses. The COVID-19 cannot last outside very long. Inside on a surface where it's not exposed to UV lights, it can last. Again, it's as as clear as mud. It can last hours or days. Is what the CDC says. So not clear at all. But yes, UV works for killing germs and viruses. Heat works very well, especially against coronavirus. Coronavirus does not do well in heat at all, and cold temperatures. That works as well. So yeah, there's technology out there. There's tons of different technologies. But again, just going back to elementary, water and soap.
Got it.
One of the questions that I got actually before our webinar. Can actually employers actually take the employee's temperature at work to determine they have actually?
Unless they're trained medical personnel, I wouldn't recommend that. We live in the world of liability, right? Unfortunately, especially when it comes to health and safety, there's always liability. I mean, this is a new world. This is new to I would say the United States, but it's new to the world of how we're dealing with this. We're kind of making it up as we go along. What works, what doesn't work. I wouldn't start playing doctor and taking temperature. You tend to run into more trouble than it's worth. The best thing you could do is tell them to go home and self-monitor. Mm-hmm. That's another word that they're using, self-monitor. So they can go home, take their own temperature, and then see if it goes up or down, and then they can go to their own doctor. Even now, let's say me personally, if I started to feel a little feverish or something like that, I am not going to run to the ER. I am not going to run to the doctor. That's where you're going to get it, in my opinion. So to answer your question, I wouldn't recommend it.
Another question that I got from other manufacturers before our webinar was, let's say one of our employees are actually, they have, let's say, coronavirus, right? COVID-19, let's say. Do we have a responsibility to report this to, say, CDC, for example?
So yes, well, New York State says you have to. Now, you're going to have, so again, this is not clear at all. Who reports? That's not clear at all. the testing facility that gets the positive, so they're going to take the test and they are going to run the test, and then they get a positive, and then they tell the patient, yes, you tested positive for coronavirus, and this is what you should do, blah, blah, blah. That testing facility is going to give that information to New York State. That's how they get all their statistics on all these tests. New York State says you, as the employer, need to report it. However, the testing agency is reporting it. So it's very vague. It's very vague.
Okay. Yeah, that's.
What you're going to do is, let's say you do have positive, you're going to end up calling New York State Department of Health, and most likely you will be on hold for 2 hours, and you have to make a report. But let me dig into that a little bit further. Maybe they set up a website, maybe they set up an email, and it's as simple as that, with a name and employee number, and you submit it. But let me do some more research on that.
Okay, sounds good. Thank you, Christian. So another question that I received from our members at HIA-LI and from manufacturing community. So some of the businesses are essential, some of them are still actually working, right? And some of them actually still hiring, by the way, right? So one of the questions that I got actually, when we are hiring employees during these COVID-19 conditions, so what steps do we take to protect our employees, and how we should basically, guide them, basically? So these are new employees coming in, right? So they're being hired. So what we should do, what kind of steps that we should take?
Yeah, it's just like having any visitor to your facility. Social distancing, absolutely. You want to keep that 6-foot distance. The interviewers, they have the right to wear gloves and N95 masks, to protect themselves as interviewers. A lot of people, especially, I don't know if you guys were able to do this, but if you're working from home and stuff, a lot of companies were issuing laptops, and they were issuing video recorders and stuff like that. And the people that had to issue them, they had to be protected. Those people that are in association with them need to be protected. So I would definitely do social distancing and provide them with gloves and an N95 mask if they request it. It's not required, but if they request it, you can provide it to them.
An interesting question might be, do you require them to have a physical before they report to work?
That's a little difficult because you're getting into HR issues, and I would need an HR expert to answer that. Unless somehow they, it inhibits their, like you couldn't ask somebody, hey, are you diabetic? And if you're diabetic, I don't want you working here. You get into a very murky area. An HR expert would have to answer that.
Good point.
There is so actually Christian pointed out one thing. So this is not actually about only New York, right? So this is not only about California or Texas, or not even only about United States. So it's actually a global pandemic. So when we talk to anybody, basically, we have solution partners, business partners in different parts of the world. We connect, Europe, we connect Italy. We are getting, similar feedback, similar news, basically. We get in touch with Asia. We talk to, Malaysia, Indonesia, Thailand, for example, for business purposes. It's pretty much the same conditions. I mean, same, experience that they are having. I mean, I was talking to somebody from South Africa starting, today is Wednesday, right? So starting tomorrow, the country will be under lockdown for next 21 days, for example. That's in South Africa. So these are similar experiences, what we're experiencing pretty much in the United States. So that's, so I agree with Christian in a way that, so when these pass, I think globally we'll have to look at many different things, our policies, procedures, risk management, as well as, health and safety procedures. It's going to be a global, it's going to make a global impact. That's for sure.
Well, as business owners and as somebody that's responsible for, again, business continuity, when this is over, we have to say, hey, if this was ever to happen again, what would be the correct steps in taking to make sure that we remain viable during these times. This was kind of, you kind of hit over the head with this. And, New York State says, hey, you got to shut down. A lot of people freaked out. And, we're shut down this week and maybe you shut down next week, but at what point does it become, chaotic? So yes, once we're out of this, need a clear path of business continuity of, how you would deal with this in the future.
Yes, correct. So one of the things actually I've been thinking about, what if all the companies that, as, business owners and other companies basically record the travel data of employees, for example. So let's say I go for business, let's say I go to, let's say Asia. Okay, so you record it. You have a, we have a register basically. You record it in your system. Where I go, how long I stay. I stay in, let's say, X country for a while. I stay in China, let's say, for 2 weeks. So you record it in your repository digitally, and then you go somewhere else. Let's say you go Texas for, let's say, for 3 days for a trade show, and then Ron goes, let's say, West Coast, let's say, for 7 days for, talking to visiting X customer. So imagine all these are recorded by each company. And if a pandemic, starts from a certain region, for example, you can easily actually pull up those records and you know who's actually been there. And imagine all the companies actually keeping that kind of register, the kind of record, for example. Of course, that has to be, safe and secure. That has to be confidential. You need to keep it safe and secure. But with this kind of, pandemics, it's emergencies, right? So that you can just pull up and then see. And every single company has this kind of record, and you can see who's been there, where, how long. I think it can be a pretty good clue to, follow up disease, to, quarantine people, to ask them to isolate, to take, precautions in different departments, different companies. That may be a pretty powerful record to use actually in this kind of situation. That's what I have been thinking about. Because right now we have no record basically. So, someone goes somewhere, I go for pleasure, I go for work, here, there. We have no, central information to see who's been there where exactly from the, company's point of view. We may have records, maybe from the travel records, I don't know how much we can, access that, but from the company's point of view, having that kind of record is can be a lifesaver.
I agree.
Good. Let me.
Just a quick point, Saad. If you look in the chat room, it looks like somebody had sent us a link to from the SHRM website that says that the EEOC has authorized companies to test for temperature. So that's a new reading that just came out recently. If you take a look at the chat.
Oh yeah, that's great. Yes, absolutely. Thank you for sharing. I appreciate it. Also, I think there are some comments as well as to what CDC has been posting. Maybe Christine, you can take a look at it. It's in the chat box. So
yeah, I'm looking at it right now. Yep.
Okay, great. In the meantime, I'm also checking my other questions that I have been receiving. Yeah, looks like I've been actually sharing all the questions. Okay, one of the questions is actually interesting. So as to take precautions, as for safety purposes, it doesn't really matter if that's a temporary employee, temporary work, or if it's a permanent position, right? So safety precautions are safety precautions. Am I correct? Doesn't really matter in that sense.
I missed the question. Can you say the question again?
Yeah, the question is like as to safety precautions we are taking, and also the training that we are giving to employees. Doesn't really matter if they are temporary employees or permanent.
Correct. No, you as the employer are right. Have to for employees and temporary employees. Because that always, so OSHA has this big initiative to protect temporary workers, because they're always like, who takes responsibility, the temp agency or the employer? And it's like joint responsibilities, but no, the employer is ultimately responsible for the temp employee. Got to make sure they have proper training and equipment and all that stuff.
Okay, great. I think I shared all the questions that I have been receiving before and during the webinar. So I think it's been pretty helpful. Ron, do you have any questions, any remarks that you'd like to share?
No, I think this is great information to share with our constituents, with manufacturers and other folks that are serving manufacturers. Appreciate the opportunity to bring in our safety expert, Kristen Panella, and share some of the experiences that we've had.
Kristen, thank you so much. Great insights, much appreciated. You're always welcome. Welcome to our meetings, webinars. Please, please join us anytime.
Great, thank you.
Thank you very much.
Will this be available online if we want to take a look at this later?
Yes, absolutely. So what I'll do is I'll be sharing the recordings with you, and as well as our attendees. We'll put it on YouTube. We'll also send you the raw recording as well, and you can review it. You can share with your contacts as well as other manufacturers. So we like to share. We like to put the word out because Christine shared a lot of insights, very important, very educational, much appreciated. So we need to share these with our community. So that's important. So when we are coming to the end of our live education webinar, live from New York, thank you so much for joining, much appreciated. I'd like to thank our panelists. I'd like to thank Kristen, I'd like to thank Ron, our co-chairman, and thank you for their insights, much appreciated. So we'll be continuing our education webinars next week as well, and I'll be sending you our invitation so you can register. And we'll continue this series every single week. And also, I also spoke to Ron earlier, so we are also planning to have a actually committee meeting live via GoToMeeting in this environment, because we can also use our webcams if you like. We can continue having our conference calls. So we're gonna be actually very active in coming weeks to make sure actually we are fulfilling our mission as Manufacturing and International Trade Committee of HIA-LI. I would like to thank you for joining. Thank you for your time. Again, our contact information is actually on the screen. So if you have any questions, if you'd like to continue this conversation, feel free to contact us and we'll be happy to assist you. Thank you very much, and looking forward to seeing you in our coming education webinars. Have a nice day. Thank you.
All right. Be well, be safe.